Hi everyone, welcome back to Nurse Katherine here. Welcome back to another educational video. In today's video, I am going to be talking about the medication rights and how to give your patients medications. So all throughout nursing, the medication rights have changed mostly in how many rights there are. When I was in nursing school, there were only 5 rights of medications. Towards the end of nursing school, I believe it was 7. Now I'm seeing there are even 10 or 13 medication rights. So today we are going to talk about the 10 medication rights. The first right that your patient has, or that you need to know, is the right patient. You would be surprised how many med mistakes You would be surprised how many medication mistakes are made when giving patients their medications. So number 1, right patient. Number 2 is right time. Number 3 is right dose. Those 3 just sound so good together. Right patient, time, dose. So is this medication the right time to give it? And is this the right dose for this patient? And remember, these are things you have to ask yourself even before you give your patient medications. Next is the right route. So is this going through oral? Is this an IV? Is it rectal? Is this NG? Is this a PEG tube? So what is the route? And make sure the order matches what you know it should be given. I have had an order that said oral when this patient doesn't even take oral medications, and it was all through a PEG tube, and I actually had to get a different medication. So make sure you are checking that. Next, is this the right medication? I probably should have said this one in the beginning, even before the time. Is this actually the right medication? Does the label match up with the MAR or your order sets? Next is the right documentation. So are you documenting this the right way? But even before you get to the right of documenting, did you give this patient the right to refuse? Patients can refuse their medications, and it may not be the best idea for them, but they do have the right to refuse their medications. And that is your next right. Now, these next 3 rights are ones that I did not learn in nursing school and that I am now seeing that are out there. And that is the right assessment. Have you assessed that this patient actually does need this medication? Which makes sense because you wouldn't want to give a patient a blood pressure medication that is going to plummet their blood pressure when their blood pressure is already too low. Next would be the right education. Did you actually teach this patient this right before giving this medication? Do they know the side effects of this medication? Do you know the side effects of this medication? Which leads me into my next right, and that's the right of evaluation. Has this medication done its job? Has this medication given this patient a side effect? So that is on you as a nurse to teach these patients about the side effects of these medications and to evaluate at the very end whether this medication did its job or not. So those are your 10 medication administration rights. If you have learned more than 10, please comment those below. I would love to know what is being taught nowadays, because 4 years ago, I only learned 5 to 7. And now we're already up to 10, and I have seen 13. So let me know what you all are learning. Next, let's go into how to give a medication. And this is where I find a lot of new nurses make a mistake when actually giving the medication. And this is why they make the mistake. So you are taking your medication out of the Omnicell or the Pyxis system, if you have one, or the med room, and you are checking against the patient's name. You are looking at the time. You are then looking at the medication and making sure it is equivalent to what is on the screen or what is on your chart that you are comparing it to. You are also looking at the expiration date. I have had medications that have expired that I have pulled from the Omnicell, so make sure you do check those expiration dates. It does take a little while, but that is important. So you're checking everything, and then you're bringing it into the patient room. You are going through every single one of those rights even before you open the packaging, even before you scan your medication. You need to make sure all of those rights you have gone through your head before you give this medication. Then you can do your patient identifiers. Is the name bracelet the same to the computer screen? Have they told you their name and birthday? Does that match their name bracelet? Does that match the computer screen? Have you given this patient the right to refuse these medications? Do these meds need to be given with food? All of that. Make sure you check all of that before you pop open the pills. And that I cannot stress enough. I have had new grads with me that have popped open all these pills, put them all in the same med cup, and the patient's like, actually, I don't want that one medication. One in a med cup of like 13 pills. So make sure you go through all of the meds with your patient, tell them everything that you have for them, even before you open them and scan them, because they will refuse. Some people will refuse the meds, so make sure you review every single medication with these patients so they know exactly what they are getting, because maybe they might just refuse that one and you don't want to have to go back to the Omnicell to get every single med, because now you put them all in the same cup and don't know what is what. So those are your medication rights and how you give oral medications. You have any questions, please comment below. Other than that, that is it for today's video. Thank you for watching. Do not forget to subscribe and like this video. Also, don't forget I am doing live NCLEX reviews every Monday on my Instagram account. So those are at 4:30 every single Monday. So stay tuned for those. All right, other than that, have a great day, guys, and I will see you guys in tomorrow's video.